Good afternoon, everyone. My name is Simran
Good
Chaudhary, and
afternoon.
I welcome you all to our panel discussion on Healthcare Budget 2025, Breaking It Down. Thank you all for joining us today as we dive deep into the key aspects of this year's budget, focusing on the opportunities and challenges it presents for hospitals, pharma, and medical education. Presented by our Finance Minister, Ms. Nirmala Sitharaman, the Union Budget 2025-26 marks a significant step towards strengthening India's healthcare system with an increased allocation of rupees 99,858 crores, which is a 9.78 increase from the previous year's budget. So, this year's budget focuses on expanding healthcare infrastructure, promoting research, enhancing medical education, and driving growth in the pharmaceutical sector. It brings crucial investments to areas such as Ayushman Bharat, cancer care, medical education, and innovating digital health solutions. This afternoon, we are honored to be joined by our distinguished group of experts who will share their insights into how these budgetary announcements will shape the future of India's healthcare ecosystem. Now, I would like to introduce my panelists for the discussion. Dr. Subhash C. Mandal, National Honorary General Secretary of Indian Pharmaceutical Association. Welcome to our show, sir.
Thank you.
Thank you so much, sir. It's an honor to have you. Dr. Rajiv Chhibber, Vice President of External Affairs at Sahajanand Medical Technologies. Welcome to our show, sir.
Thank you.
It's great to have you with us.
Same here.
Dr. Rajiv Rao, Dean of D.Y. Patil University School of Medicine, Mumbai. Welcome to our discussion, sir.
Thank you. Thank you for having me.
Thank you so much, sir, for joining us. Dr. Upasana Arora, MD at Yashoda Hospital, will be joining us soon. With that, we'll be starting that together. Our panel will explore the government's focus on enhancing healthcare access, driving innovation in medical technology, and ensuring a future-ready healthcare workforce. So we'll also touch on how these initiatives can bridge gaps in public health, maternal care, cancer treatment, and more. So let's start the discussion by exploring how the increased budget allocation for key healthcare initiatives will deliver a district and territory level healthcare growth. So, with that, my first question is to Dr. Rajiv Chibber. So, what are your overall thoughts on healthcare budget for 2025? Do you see it addressing the sector's current challenges effectively?
Yeah, thank you, Simran, and thanks, Voice of Healthcare, for this very timely discussion. In fact, as you said it in your opening remarks itself, the budget 2025 it presents a very positive outlook to the pharma, medtech, and the life sciences sector. And the first thing I think which everyone would be upbeat is, the increase in the overall budgetary allocation, which is approximately 10% higher to the previous budget allocation on the healthcare. So, this is a fillip that possibly can really make a difference year over year as we try to inch towards achieving that 3.5 GDP, assumption of healthcare budget being into the available to the country. So it's a significant amount which has been given this year to the budget. And the other things which added on to it, which really made the budget more and more lively in terms of the pharma and the life sciences sector, was the basic custom duty exemptions on medicines and drugs for rare diseases, cancer, and I think even on severe chronic diseases. The additional patient assistance programs which majorly hospitals are doing is also a very good initiative, and I'm really sure that MVA, which is medical value tourism, will surely get a new fillip through this entire thing. Uh, I think the real part here is how the medical device sector can actually contribute to the budget itself. And I come from the medtech sector largely, but if you look at it, we've got boosts in Heal in India. where new age technologies through medtech devices will be available to a large population, and obviously that population which not only the expanded Ayushman Bharat is there, but also the increased population that we are now seeing in rural, peri-urban, and also the class one, class two cities that are really growing. The other aspect that we can actually look at is the boost to the private sector through the R&D and innovation allocation of approximately 20,000 crores. Now, this is in line with the strategy of the four, engines that the honorable finance minister mentioned to, which is development and growth of the country for advancing a Viksit Bharat mission and also an Ayushman Bharat mission itself. So I think through various nuances, without possibly taking the name of maybe medical devices, there has been an allocation which is very, very hearty. The other things, the allied things that really have impacted is, the allocation to shipping, ports, infrastructure, digital, IT, and not to mention, the increase in the medtech seats, etc., the medical college seats, etc. That adds on to the entire medtech sector, because the moment infrastructure is boosted in our shipping and the airline services, it's a big relief to the supply chain that we look at, whether it is through raw materials or even finished goods which India manufactures and is sent across the globe. And then obviously, you mentioned it very, very well, is getting a future ready healthcare workforce. And I'm sure Dr. Rao here would also be able to give his views on this. But yes, this is going to be a great fillip. And I normally call this fillip as an AI. It is also artificial intelligence that is going to take healthcare forward, and a renewed focus on AI, which is academia and industry partnerships, which will take this forward. So overall, it's been a great allocation in the budget.
Thank you so much, sir, for giving us your views and your opinion on this year's healthcare budget. Moving on to my next question, Dr. Upasana. Welcome to our show, ma'am. It's a pleasure to have you with
Hi.
us.
Hello. Yeah. Good evening,
Thank you
everyone.
so
I am Upas. Yeah. Please ask me your question.
Ma'am, this year's budget significantly focuses on cancer care, women's health, and affordable medicines. So, how impactful do you think these measures can be in short and long terms?
So, first time, I am happy that first time this budget is perfect for everyone. Even we are as a healthcare industry. We were all the time looking for something for healthcare, and luckily, from last two budgets, we got something. But this budget is more attractive as they have just reduced cancer and all life saving drugs custom duty. So it is going to be very helpful for patients as well as healthcare provider, because when drugs are very expensive, then we are supposed to charge accordingly, and it's very heavy for a common man pocket. So this is a very welcoming step, as well as they have they want to give a broadband facility free of cost to the PSC CSC, which is going to be helpful for those who are living in rural areas. And we can you know we can do something in PP model, like private and public partnership, so we can also provide them super specialty, all the consultation and other things. Same time, they are asking for more medical colleges. They are going to announce 10,000 seats, and these things are very good for healthcare industry. So I think this budget is a very good budget for our industry, and we are quite happy from this.
I agree to you, ma'am. As if compared to the previous year budgets or to the responses which we got, that I think healthcare people were very not happy with that. So I think this year we got a significant rise and a portion of this year's budget. Moving on to my next question, Dr. Subhash. Sir, the budget emphasizes on life-saving drugs and tax exemption for bulk drug manufacturing. So it is a significant step. How can the pharma industry leverage this to enhance the affordability and availability of this critical treatment?
Thank you, Simran, for your questions. First of all, I would like to mentioned, there are so many components to be happy in this budget. Firstly, it has already been mentioned that BCD, that is Basic Custom Duty, has been removed from 36 drugs, critical care drugs, especially in cancer sector, as well as the rare disease as well as critical care area. And additionally, six more life-saving drugs, they are also getting these, exemptions. And further addition, 37 more drugs which are being involved in patient assistance program, that has also been getting this exemption. So all of these is a very welcoming step for the patient in general as well as the healthcare providers, because this will help in reducing the price of the drug what our patients are paying from their pocket, and as a result, it will increase the affordability. What is the goal of our government? And we also expect that the affordability will be more. Uh, but in addition, we expected the government would reduce its taxes on all essential medicine, and we are expecting that later on it will be added. And the exemption of this tax component on bulk drug of these medicines, that will also help the industry to grow. And I mean, there are some other component as component like 10% increase in the health budget, and specifically increase of budget for biotech sector. There is a quantum jump, around 40% increase in case of biotech sector, research and development. So there is a chance of increase in the biotech sector, and that will help our industry grow as a whole. And the other component has already been discussed, that is skill development, excellent skill center setup in different cities, that will also help developing the skill manpower for the development of the pharmaceutical industry. And there are some additional points like Posan scheme, through which government is going to provide the nutritional food to the child adolescent girls, the pregnant and breast feeding mother, and this will also boost up the growth of the industry as a whole, and it will be a booster for the pharmaceutical industry. Uh, as a whole, these are all different points of where we may be very hopeful, and that will help the industry to grow. But there are some few points which industry expected that is not been fulfilled, like they expected the elimination of custom duty on certain more cancer drugs. Then they expected much quantum jump in R&D sector, specifically for the pharmaceutical sector, as well as they expected to strong implement of these the medical device sector development program, uh, and overall the expectation from the patient as well as the general people, that this
So,
custom duty and the tax component of all essential medicines will be should be exempted. So this is all my general comment on this.
thank you so much, sir, for your views. Moving on now, I would like to ask my next question to Dr. Rajiv Rao. Sir, the government plans to add 75,000 medical seats over the next 5 years. How can we ensure that this expansion is accompanied by quality education and adequate faculty resources? Because the seat will increase the demand of teachers and also infrastructures, and the latest technology also increases. So, how are we planning to bridge that gap?
Thanks, Simran. Very relevant question, because I think adding 75,000 seats into the general healthcare medical education sector is not going to be easy. There are certain requirements to ensure that you have quality education, and like you mentioned, faculty requirement is number one. Second is proper infrastructure, and the third is clinical load. Now, a lot of our medical colleges are concentrated in pockets in certain states or in certain districts or certain metropolitan areas. And then the clinical load is now getting distributed among those same colleges and the same. So the number of patients available to each college, first of all, becomes less. So if you're going to start new medical colleges, then it has to be on the basis that it reaches, or those medical colleges are opened in such places where proper quality healthcare is not available, not in metro cities or in tier 1 or tier 2 cities. So that will be the first need of the nation. Second, if you're going to say we're going to open medical colleges in districts and just convert district hospitals into medical colleges, that's easier said than done, because the medical college is just not a hospital but also a college, and relevant infrastructure to run that
Hmm.
college, including lecture halls, practical theaters, libraries, and associated paramedical staff and nurses are going to be needed to run this kind of setup. And third, of course, is faculty. Now we're already in this present scenario, we are already facing shortage of faculty, especially in certain branches like anatomy, physiology, biochemistry, forensic science, forensic medicine, radiology, dermatology, certain clinical branches, there are already a shortage of faculty. Add to that challenge of getting the faculty to move to places where healthcare is not accessible, or is not where you don't have such good facilities. That's going to be the second challenge. I think one way to do it is to embrace technology. I think we will need to improve and use simulation to a larger extent in training our students. Where clinical material is not available or may not be available, we should go into technology and use simulation, skill development, all of that, to ensure that our students get proper skills. Second, we have telemedicine. Why can't we have telelearning? Maybe you can share faculty across colleges instead of just saying that this faculty is only for this thing. So when you're having a lecture and you're giving a lecture to 250 students, why can't you give it to 1,000 students spread across 4 or 5 colleges? So when you want senior faculty to deliver these lectures, then those lectures should be available across a broader spectrum of things. Third is there's a large number of private healthcare professionals who are not part of the medical education system. So we need to
Hmm.
find a way to make it inclusive. I mean, we there was a time when these doctors were honoraries in large government hospitals, and they were excellent teachers. We don't expect them to be there for 8 hours or 10 hours or be over there, but their expertise, their value, and their experience in healthcare should be utilized to train our students. They can be part of this. They don't have to be the main faculty. Of course, we can of course get them as adjunct faculty. So if the relevant health authorities, the National Medical Council, the Commission, all of these get together. Also, healthcare needs to be inclusive. We can't just look at allopathy being the one-stop healthcare providers to the nation. I think we have a strong sense of Ayurveda, and we know that we should trust our own system, a scientific way in which we can use Ayurveda to take care of the healthcare needs of our population, and see how we can include them into providing teaching methods as well as being part of the healthcare system. If we do all of this inclusively, then over a period of time, yes, we can not increase 10,000 seats a year, but we can also ensure quality healthcare. This thing, a large part of this budget allocation for these 10,000 seats is going to be in basic infrastructure, but we'll also have to see how we can get voice cameras in your lecture halls. How can we get simulation into the medical college? How do you get skill development into the college? How do we pay your faculty well enough, and and make sure that they come to places where they should be there? And one way to do it is to introduce a separate medical cadre. uh, just like you have a medical, you have the IAS, the IRS, the IFS. We should have an Indian medical service cadre also for doctors, that will greatly help in getting relevant people into the system, and it becomes lucrative as well as financially rewarding and emotionally rewarding for them. So yeah, I think this could be the way forward.
I think you pointed out all the right points, sir, because that will increase the burden of, including all the aspects of healthcare, will decrease the burden of dependability which we have in allopathy. I believe if Ayurveda will come in, and I think government is prioritizing Ayurveda as well, so they are working a lot on that initiatives as well. So that will help us to divide the burden of the patients and the cases and the treatment. So, moving on to my next question to Dr. Chhibber. Sir, how do you see the medical device sector playing a key role in supporting the Ayushman Bharat initiative, especially with the recent budgetary allocation for expanding healthcare infrastructure and making treatment more affordable?
Yeah. So I think I did allude to this in the first part of my response to you earlier. But let me go slightly more technically into it. So when we look at a boost to a couple of areas within this entire budgetary allocation, this is basically the garib, the youth, the Annadata, and Nari, which is Gyan, GYAN, that the finance minister emphasized. It is exactly a replica of what healthcare needs to also do to the entire fraternity. Now, the emphasis was on high end infrastructure, the emphasis was on digital development, the emphasis was on PM's Gati Shakti sustainability push to look at impacts to business, to domestic manufacturing. The focus was on MSMEs, the focus was on startups, and obviously, as all the all the other panelists mentioned, a healthcare boost to rare diseases and cancer area. Now, if you cumulatively look at this, uh, a large part of this is serviced through medical devices, and they become the first harbingers towards technology being entrusted, and then the quality manufacturing, which will actually be available to hospitals, which will be available to physicians, which will be available to also larger PHCs, CHCs, and even the Ayushman Bharat Kendras, etc. So while per se there were no announcements made towards medical devices. However, the strategic push towards MSMEs with loan credits and startups with almost like a 10,000 crore availability of fund is going to really help the quotient of availability, accessibility, and new age technologies that will be available within the Ayushman Bharat scheme itself. Then let's look at the other parts of it. That this Gati Shakti data, sustainability push that the finance minister talked about. How will it help? It will help in disease dynamic profiling through hospitals. I mean, they'll be able to look at it. This will help the medtech sector be prepared where and how to place our technologies and equipments in hospitals or areas. So that's going to be one large area that we would be able to cater on when we look at disease dynamic profiling through the Gati Shakti data that we have. So it will not only help in disease dynamic profiling, but also for a smoother planning of supply chains too, as I mentioned. See, globally, there are three C's that are being challenged, and these three C's is something which India has been able to really tick box very well. And this is conflict, which is happening globally. This is commerce, because of which right now there is a global slump in the entire economy. And the third C is, your care, the quantum care that is required. And all these threes have been very well tick boxed by the Honorable Finance Minister. Now, when you look at the expansion of NHM, that 5-year expansion that National Health Mission has got, obviously there will be more and more avenues where medical devices will be required, whether it is on screening for critical diseases, for cancer care, for NCDs. India is already a capital in NCDs. It will strengthen the entire expansion that is required. The strengthening of the Udan scheme, or even the shipping sector, as I said, that will increase connectivity and logistic handling. the transforming of cities as growth hubs, as the finance minister said, it will obviously create more and more avenues where hospitals are bound to grow, where medical institutes are bound to grow, and even where there is going to be an expansion of a demand too. Then if you look at Heal in India and the medical value tourism that was mentioned, it is again going to give a strategic push towards capturing and catapulting an impact in the sector. And there is going to be a volumetric growth. If we see, we're already a $15 billion industry. The medical device industry is already a $15 billion industry. With all of this, and this strategic push is in any case by 2030 going to assure that India reaches a $50 billion medical device industry, and possibly by 2047, when we look at a Viksit Bharat, this strategic push will surely create almost over a $300 million medical device industry, which India will actually command. And through India, we will be able to be a Sanjeevani towards health tech, towards deep tech, and towards med tech.
You explained us very well, sir, how this budget is going to help Indian healthcare industry to grow and the future of our healthcare. But that is great, and I think our government is also looking forward to that, and that's why we can see this big jump in our healthcare investment by the government. So thank you for explaining us on that, sir. Moving on to my next question to Upasana ma'am. Ma'am, with the announcement of 200 day care cancer centers across district hospitals, how can hospital prepare to offer decentralized cancer care service while maintaining the quality and affordability?
Actually, this is a very good initiative because, as we can see these days, cancer is growing like anything, and everyone is suffering. So, if we can provide daycare center in district hospitals, it is going to be very cost effective, and people who are actually not able to go to private hospitals, they can get treatment there. Same time, this Ayushman Bharat is also very good for those who are not able to afford healthcare. But when we talk about cancer center, it is a very good initiative by the government. And if they want any kind of help from private sector, I think we can do something hand holding kind of thing, like if district hospital is not having any specialist or something, we can help them. And at least right now, those who are not able to afford this expensive treatment, they are going to get very big relief, which is good for the society.
We can't hear you, Simran.
Sorry, I'm sorry. Thank you, ma'am, for rightly pointing out how it will benefit. Now, my next question is to Dr. Subhash. Sir, the government continued the support for the production linked incentive scheme, which is crucial for local manufacturing. So,
Yes.
what more can be done to strengthen India's position as a pharmaceutical hub?
Yes, that PLI scheme is a very important step by the government. They have already taken for the last few years. But very unfortunately, this is not being implemented rightly, uniformly throughout the country. And it required to be implemented in terms of its spirit around the country, and should not be localized in a particular area or zone. As for example, a few industry from the eastern or northeastern sector of our country benefited from uh, this program, and they also expected dedicated R&D fund for the pharmaceutical industry and some sort of relief for extending the tax exemption on spending on R&D budget. They expected it maybe 200%. But these things have not been properly addressed in this budget. So these two component is required to be stressed upon the. I mean, uh, larger budget for R&D in pharma sector and uniform implementation of PLI.
Yeah, I'll also,
Thank you so
add to
much.
what Dr. Subhash said. The PLI scheme is also applicable to the medical devices too. So, if you look at it, I agree with Dr. Subhash on that. That the PLI scheme for even the pharma as well as in the medical device sector should also be expanded to other, areas also. Right now, if you look at the PLI scheme in medical devices, it has actually focused on four key segments, which is cancer therapy, radiotherapy, imaging devices, and your implants, all implants, which is implantable electronics or even implantable devices. This needs to expand, because right now if you look at India is a net exporter of key medtech devices in the areas of disposables, consumables, electronic equipments, etc., surgicals also. But when it comes to high-end medical devices, which is your high-end implants, which is your radiology and imaging medical devices, I think we need to expand more and more, because it is these high-end medtech sectors that are more import dependent. And with the manufacturing push that the Honorable Finance Minister gave this time to the manufacturing sector, or the domestic or the domestic manufacturing sector, I think that if it's backed by the growing healthcare needs and the government's commitment to facilitate growth, I think not only the pharmaceutical sector but the medical device industry's potential for growth is going to be immense. And in nowhere's time, we're already called the generic healthcare basket of the world. In nowhere's time, in the next 5 to 7 years, we will also be called the medtech health hub of the world too.
So I think, like you said, currently it's being focused on the oncology and the diagnostics and other cases. I think slowly and gradually we'll expand our network. We'll expand that
Expansion
scheme
is
to
needed.
other. Yes, we'll expand there, and we'll broaden our PLI scheme there. On that, my question to Dr. Rajiv Rao is, sir, like Upasana ma'am also mentioned, Dr. Rajiv and Dr. Subhash also mentioned that the oncology or the cancer cases are being, increasing nowadays. So, what steps can be taken to encourage more medical students to specialize in critical areas like oncology, pediatrics, and rural healthcare?
Uh, one, when I was a student, professor of mine asked me a very relevant question. He asked me, Rajiv, what is the difference between cancer care or cancer in a patient 10 years back and now? And we gave him all the gyan, that we say that diagnosis is improved, treatment is improved, and all of that. And the wise surgeon that he was, bless his soul, he said no. 10 years back, a person had cancer. He didn't know about it for 9 years. Then he came to us and he suffered for a year and he died. And today you diagnose a cancer in the first year, he suffers for 9 years and then he dies. I think we moved a lot ahead of that time, but that were very, very striking words that he said. That it's not it's not what you've done in treating the cancer that's the thing, it's the way that you're diagnosing cancers. So I think if you really, really want to treat cancers, the key is not just touching base with doctors, but it's touching base with the population to help you catch those cancers early enough. I think if you want to reduce cancer care or you want to reduce the complications in cancer care or treatment, it's important to get them earlier enough. If you pick up a cancer very early, your chances of cure are much, much higher than just saying cancer care. So it will have to be multi-pronged. It's just not enough to open cancer care hospitals and touch base and say how many more doctors are going to get in. See, it's ultimately everything is market driven. Even for
Yes.
even for a doctor to get into any branch, a lot of it is market driven. If you look at the super specialty branches that are thriving today or where there's a demand from our students, cardiology ranks number one. Then and nobody is going for CVTS. Nobody is going for a pediatric surgery, but neurosurgery is very high. Why is that happening? It's because the market asks for it. So same way, I don't think if there's really a large number of patients that are there for cancer, our our doctors will but of course go towards medical oncology or radiation therapy or oncosurgery. The reason why you don't go on those lines or why you're not having many doctors going there is because these doctors need a very specialized setup to take care of their patients. If you're able to give the specialized setup, then obviously you're going to get doctors reaching there. If you want an oncosurgeon to operate, then you need to give him a specialized operation theater for it with all the ancillary. You need blood, you need an ICU, you need proper post-operative care, you need follow-up treatment, you need a PET scan, you need MRI, all of that happening. So it is not just enough to produce. You have doctors interested in taking up oncology or oncosurgery. It's the whole ecosystem that needs to develop. Today, you have so many cath labs coming up. You have patient awareness that I may die of a heart attack. And so they come to a cardiologist, they're asking for cardiologists. And that's why you have so many doctors wanting to take up cardiology. Similarly, if there is awareness about preventive oncology, then you have more patients coming in and saying, I want to pick up if I have a cancer early enough. And you, at the other end of the spectrum, you have not just daycare centers, you have cancer hospitals where doctors can operate freely, can take care. You have radiation centers where you can treat them well. Then obviously, yes, you are going to have doctors freely coming in and saying, yes, we want to be oncosurgeons, we want to be medical oncologists, we want to be radiation specialists. But I think the other push that in one way the finance minister has done is encouraging startups, because
Yes.
healthcare in India will need a very radical approach. We cannot ape the Western world in treating our patients or taking care of our patients. Our problems are diverse, our problems are different. And we'll have to look at technology, we'll have to look at a very different approach. Can I get a CT scan or an MRI in as a mobile facility? Can I get it in a van? I think startups are going to have this very different approach. For example, I was part of a startup this thing where they were looking at um, infrared technology to diagnose breast cancers. So you don't need a CT scan, you don't need MRI, you don't even need mammography. And infrared scanners are very, very cheap. They're not so costly and they're mobile. So I think India and this is waiting for its eureka moment, and encouraging startups to think differently, to take a different path is going to be the way we are going to take care of cancer and take care of the healthcare needs of our country.
Thank you, sir. But like you said, keep people like people are more towards the cardiology and everything. Their fear of getting a heart attack, and they go to a cardiologist. I think the symptoms and the awareness of a cancer is not that people know about it. So I think that's why they're not afraid of cancer, or they take into this preventive action or any those kind of steps. But I think as the concerns and the cases are growing, people are choosing more of a healthier lifestyle, so it may decrease the case of that. And as the awareness is rising, they may go to or do prefer all those steps which helps into detection of cancer at an early stage rather than treating or detecting at a later stage. So I think that's
I'm
a
going to
bit of the.
add a little bit to that. When you say healthier lifestyle,
So
I think when you say healthier lifestyle, then are we breathing healthy air? Is the food that we
that's
eat
the question.
really healthy? So I think the government has to have this holistic approach where everything that relates to us, how um, how sure are we that the food that we eat or the vegetables that we get are pesticide free? How
No
sure we
control over that.
exactly? Then how are you controlling cancer? Because these are your carcinogenic. They're saying your air pollution is what is going to lead to lung cancer more than
So
smoking. I'm worried about the air pollution. The food that we eat, even if you take non-veg food, everybody knows there are microplastics in fish or poultry or whatever you eat. So how are you preventing those kind of pollutions, and what control is the government having on these things? That is going to go a long way in decreasing the number of cancer cases. You can only go to awareness to a certain level, you can go to treatment. Really want to do, you need to control it over there. Only then are we going to change something.
The root
Thank
cause needs to be addressed.
Yes.
That's a
Thank you, sir.
post Delhi budget, Delhi
Yeah.
issue that you're talking about. I hope it's not political. So just joking about it.
Yes, yes, yes.
No.
Thank you, sir. My question to is Upasana, ma'am. Ma'am, the increased allocation for the National Health Mission aims to improve public health care delivery. So, what gap still needs to be addressed to ensure that last mile access to quality care is reached at the right point of time and to the right person?
So actually, nowadays, when they started this scheme, not many people were common man was aware about this. But with the lots of advertisement and a few hospitals, like we are part of this Ayushman Bharat mission and ABDM mission, we are part of that. So, now people are getting treatment, and especially if we talk about tier 2, tier 3 cities, that is also getting such kind of treatments. So I think now this is high time we need to promote more on not only what I wanted to do, that we should not always depending on tertiary care or quaternary care centers. We are supposed to resolve problem on PSC, CSC and district level. So like for small things, everybody should not come to the big hospital and for getting treatment there. Small problems has to resolve, and then for super specialty work they should come to the big hospitals, and hospital should also offer their services to them. Only then, because any government can make different kind of policies, schemes, but those who are supposed to implement, they are also very open for this. So I think within few years, as I have seen this journey, I was part of NHA also. That now everyone, and because this time their you know policy money is also biggest. Like it was 5, now it's 10, and there are every state is having their own different kind of schemes for healthcare. So I think after some time you will find that people are very much aware about that what kind of schemes government is providing. And if with the push of government, hospital providers will also accept this scheme, only then we will be able to reach to the person who is standing in last in a queue.
Right.
Rightly pointed out, ma'am.
To
Uh,
add to that,
moving on.
I think you need to make the scheme available over a larger spectrum of hospitals. Many of these states who are running schemes are not giving the entire spectrum to all hospitals. So I think so. Then, for example, for cancer care, the patient has to access only a particular government hospital, but he cannot reach a medical college or a private hospital. So maybe you need to say, okay, there's this medical college and the hospital which is there since X number of years. So we will treat them equivalent to the government hospital, because ultimately we are sharing the government's burden, and we have the expertise, we have the infrastructure. So why are you limiting the schemes just to the government hospital and you're segregating those things? So I think those segregation has to go. That will really help in decreasing the load to the public hospitals also.
Sure. So I think there are some cases have also come up. I don't know how public it was, but they said there's a vast difference between what all hospitals or services comes under the government initiative to the private hospitals. So there's a vast difference, and due to that, some people, are not because of the situation and the condition it is, they don't prefer to go that and their way, and they often choose the private way, and sometimes the private way is expensive than the our government initiatives and the plans which we have. So I think if we can manage that difference also, we can have public more going towards those schemes and benefiting from all those things.
Yes, absolutely, absolutely.
My question to is to Dr. Rajiv Chhibber. So, what initiatives like Atmanirbharta in Pulses and Saksham Anganwadi, and how can the medical device sector help track and improve nutritional outcomes, especially in maternal and child nutrition through diagnostic devices or technological solutions?
Yeah, I think it's a very important thing that when the finance minister talked about youth, she talked about maternal child health, adolescent health, in the same breath also. It's very important that even technological advancements take part and create that kind of conducivity where technology is available when we look at malnutrition. For instance, simple devices, your wearable devices that we have these days, they can track not only your ECGs, they can track not only your iron, hemoglobin levels, etc. That needs to be feeded into a large server. That's when I talked about disease dynamics, that we need to really look at dynamic profiling of diseases. It will increase the level of understanding where to deploy what kind of medicines, what kind of instruments, what kind of stacks that the government needs to really take forward in terms of being prepared. So the preparedness level goes to a different quotient altogether. You take a classic example of maternal and child health. uh, we look at malnutrition under it. We look at how better nutrition can be actually provided and access can be increased. But has that been able to catapult into plugging key diseases that we still face? Are we able to detect thalassemia? Are we able to detect rare diseases? All these need to be streamlined when we look at technology being available to this kind of a population who is going to really take the potion, who is really going to take the advancement of pulses. And as Dr. Rao also said, when we talk about advancement of pulses, how safe are those pulses, so that in RMNCH plus A areas, which is routine maternal child health and adolescent areas, we can plug issues like cancer. It's the food that we eat. It's the kind of the environmental impacts that we have. Are we really going to make any changes into it? And there is where technology, the finance minister talked about deep tech. She talked about IT infrastructure being available. All this catapults into ABDBM, Ayushman Bharat Digital Health Mission. This is the next level that we are going to really achieve when technology amalgamates with healthcare, amalgamates with nutrition, and when there are other sectors which are allied sectors towards impacting health going to really converge. So as even Dr. Rao mentioned, it's going to be a stringent PPP model that the government has to really look at. And this PPP is in addition to the public private partnership that Upasana ji just mentioned on. I would term it as a partnership for a public purpose, because
Hmm.
here you will not only tick box children's health, youth health, maternal health, but will also be able to focus on allied sectors that are impacting health.
I think that's a very valid point, sir. And slowly and gradually, we'll move to that also.
We,
Since we're talking about the portion and the child health and everything, Dr. Subhash, how can pharmaceutical industry collaborate with public health programs like Portion 2.0 to ensure the better nutrition and health outcomes for a women and children?
Uh, yes, this time our finance minister has rightly taken up the issue because there is a lot of changes in the nutraceutical industries, and it has started a few years back when the government has laid down a new legislation for nutraceuticals. And during last few years, there are so many schemes there providing to the industry, and the pharmaceutical industry is also investing in the nutraceuticals. And now nutraceutical industry is exporting a huge quantum of nutraceuticals to other countries, and our prescribers, doctors, they are also habituated with prescribing those nutraceuticals along with some medicine. So they are already pharma industry already integrated with the this scheme. But the recent declaration of our finance minister to provide the portion to girls and child 6 months to 6 years, as well as the adolescent, as well as the uh, women of childbearing age, and especially from the aspirant district as well as northeastern region. That also given a scope for the pharmaceutical industry to expand into this sector and to utilize this. And there are some other incentives in this budget regarding development of MSME industry and the startup industry. This startup industry will contribute a much in case of pharmaceutical and nutraceutical. Already, I can give you one example. A startup from Kolkata, they have recently developed one NIR, I mean, instrument, which uh, can be utilized non-destructive testing of certain pharmaceutical and nutraceutical. You know, now the prevailing practice is the destructive testing for drugs and pharmaceutical as well as the pharmaceutical, I mean nutraceuticals. But if this technology, I expect this technology will be developed through this startup, so that they will develop some equipment which can be utilized for non-destruction of the phytopharmaceutical and the nutraceutical. So I think these all these components, they in this budget will uh, support for development of nutraceutical industry and will create a inclusive environment and the partnership with this program and I mean pharma industry.
Thank you, Dr. Subhash, for mentioning all those points with us. As we are moving towards closing of this session, I'll be asking my last question to each panel, each speaker. My question to Dr. Rajiv Rao is, sir, if you have to prioritize one area of additional focus in the next budget, what it would be and why?
Next budget. Next budget, I
So,
think. I think I'll wait for what they do in this budget to decide that. The plan is on
so
paper. How much
anything
of it
regarding the
will get?
medical.
No, I think the same thing. Considering I'm from the medical education, this thing, I'd like to see whether the government, through its ancillary arms, takes proactive steps in improving or helping us take care of at least the faculty shortfall. Does it give us access, or does it enable us to use innovative health, health teaching methodologies? That will be a start point. If that can happen, then yes, we will look at accelerating this change and taking it forward. I think
Thank
we'll also need to encourage, at least the next budget, more focus on healthcare IT, because I believe IT is going to be an enabler. It will be a huge enabler to make sure, like Dr. Chhibber said about wearing these devices. It's like an IoT, but then how, what do you do with those devices? Where do you plug them onto? Where do you get ensure that the data reaches, and what do you do with the data?
Yeah.
So IT is going to be an enabler. So how does IT help healthcare? How does the Ayushman Bharat become the fulcrum around which everything moves? That should be a focus area of the next budget, I think. Yeah.
Rightly said, so. I think with this, I'll move to my next question to Dr. Upasana. Ma'am, how can public-private partnership play a role in achieving the goals set in 2025 healthcare budget?
So I think there are two things which I expect from next budget. First, this private and public, and especially one of my colleagues said for public, not only private and public partnership, but for the public, general public who is using this, we need to work together closely. So, I mean to say private healthcare provider as well as government. They should work together for benefit of the society. But same time, I really expect this thing that somebody who is starting a hospital, or who is aligned with all the government policies, they should get some reduction in kind of, our electricity bill is just like other factories and all. So we should get some relief from government side, so that more people can come into this field, and government can have tie up with every district hospital. If we can do, like, we are going to start one model in my Ghaziabad city. We are going to give them ICU facilities online, so that if their intensives are not available, my doctors can monitor them, and they can suggest to those MBBS doctors who are looking after them that you have to do this accordingly. So this kind of if we can do this thing more closely, more other examples. Right now we have only few hospitals and public hospitals and private hospitals who are doing this, but we need more people should come forward, and government should be friendly with the hospital and healthcare, private healthcare providers.
Thank you so much, ma'am, for sharing your views on that. My last question is to Dr. Rajiv Chhibber. So, what innovations or technologies do you believe will be critical in supporting the government's vision for a stronger healthcare system?
Yeah. So I think Dr. Rajiv Rao mentioned this very, very clearly right now. I mean, unless we have an IT enabled economic system that can actually look at disease dynamics being addressed, data being really utilized towards progressive prevention of disease and also curing of disease, that will be the ideal situation. Now, even if you look at successive budgets which have come in the last 3 to 4 years, healthcare has got a lot of attention, especially if you look at pharmaceuticals or even the medical devices. Like medical devices by the Prime Minister was also mentioned as, the sunrise sector itself. The overall reinforcing, these things reinforce India's goal of medical innovation and excellence. Right now the pharma and life sciences sector continues to be a priority area in the overall budget agenda year after year. And ri- even this year, with a focus on improving healthcare infrastructure, enhancing access to life-saving drugs, promoting medical tourism, improving the entire IT enabled cities that the finance minister talked about, that is going to really make a difference. But the larger thing that we all need to be committed, or the government needs to be committed towards when we look at universal healthcare, is the increased GDP spending on the budget itself. We need to, right now we're just around 1.2 to 1.3% of the health budget, that or the GDP which is impacting the budget. We need to progressively move towards a 3.5 to 4%. And I moved purposely, the needle from 3% to 4%, because looking at the kind of expectations that healthcare is now getting, and especially post COVID, the 3% is not going to really suffice. We need good medical education. We need good professors, faculties, as Dr. Rao said. We need IT enabled, like telemedicine. We need IT enabled infrastructure to be available, so that medicines are available, accessible, and affordable. We need to also look at the fact that how technology in tier 2, tier 3 cities is going to really make a difference to people living there, how rural sector will be able to access those technologies and healthcare. And especially if you look at a new population which is really growing, and I'm sure Dr. Upasana and Dr. Mandal will be looking at it very carefully, is the peri-urban population that is really not getting addressed, which is, your maids, your drivers, your people who live in shanties, and the other dwellers who are really not able to access and have been migrated from all these cities. it is something that technology can really, really make a difference on. So I think when we look at tick boxing everything, technology becomes the harbinger, and access to healthcare through allocation of increased GDP spending becomes a mandate.
I think so. You very well pointed out all the initiatives taken by the government is basically to make healthcare more accessible and affordable, whether it is through, medical devices, pharmaceutical sector, or taking out some initiatives, some schemes, and everything. All this focuses on how we can make healthcare more accessible and affordable. And if we, as a country, while increasing our healthcare budget or launching schemes and everything, are able to reach out to the masses, to the last point of our country, or to our countrymen with the same level of technology which is available at tier 1 city or to a tier 3 or to more remote areas. I think that's the biggest achievement we can achieve through our gradual increasing budgets, more schemes, more innovation, more ideas through more startups. I think that's what we all discussed here, and we had a great discussion over the budget 2025, which our government presented this year, which we all are kind of satisfied. But we are looking forward for the next year's budget as well, and what all we'll get on that. So thank you to all our panelists for sharing their such valuable insights on the healthcare budget 25. Today's discussion highlighted the government's commitment to improving healthcare accessibility, affordability, boosting innovation, and expanding medical education. Collaboration will be a key, turning these initiatives into a real world impact, ensuring better healthcare for all. Thank you to all my panelists, Dr. Rajiv Rao, Dr. Rajiv Chhibber, Dr. Upasana Arora, and Dr. Subhash, for taking out of time out of a busy schedule and sharing your opinion, views, and expertise with us. It matters a lot for us to and our audience to create that awareness, to present the different perspectives about the healthcare budget. Thank you so much.
Thanks for calling us
Absolutely.
here. Thank
Thank
you.
you very much.
Yeah.
Thank you, Simran.
Thank you
Thank you,
very much.
Voice of Healthcare. It's been a pleasure. Thank you to the fellow panelists. It was a